But she wants to do a little augmentation to her face. Really, areas where we're concerned about the tear troughs, and also a little bit of malar augmentation. So the two injectables we're using for that are going to be Juvaderm Ultra and then Voluma. So two different fillers. You know, much higher G prime in the latter there, because it's much better for augmentation of large defects that need more bulk in those areas where, you know, when you use something thinner underneath the eye. So that's where the Juvaderm is going. With the Juvaderm Ultra underneath the eyes, we're going to come in. It's a very small needle, so you're going to come into the folds underneath the eye. This stings a little bit at first as it goes in, and then it's got lidocaine inside. So you're going to deposit a small aliquot into that area there, and you can kind of withdraw your needle as it comes out into the area you want to augment. Okay. All right. Then I'm going to come into a secondary area more laterally. Pinch here. And fill those two areas. I'm going to come back over that in a minute and spread all that filler out. That's kind of how we bluntly put it into the area. Come to the other side, do the same thing. This is just, you know, you're deep to the tissue, a subcutaneous plane. You know, some people go all the way down to the periosteum in this area. You just don't want it too superficial. Some of these newer fillers are fine. You can do that, and you don't have to worry about a Tenel's effect. But you can get that bluing of the skin if you're too superficial with some of the older fillers, which aren't as ideal for this location. Okay. So you just see us depositing a volume in this area of the tear trough. And we're going to come back and smooth that out in just a second. So we've got the volume underneath the eyes, and I'm just going to come back and just make sure and rub that volume in. You know, you always seem to rub pretty aggressively in these areas I've injected. Just want to make sure that you smooth that volume of injectable that you placed into that region out really well, so the patient doesn't get any lumps and bumps down the road. Same thing on this side. Just make sure we smooth this out. And in this region, it doesn't take a lot of volume. So, you know, we split half a cc beneath both of our eyes. So you're talking about a quarter cc beneath each eye. So small amounts of volume make a big change in this region. Okay. So now we're going to come into the cheekbone here in the malar area. If you placed a lot of cheek implants, you can kind of think about the same amount of volume in the same area, the direction you place a cheek implant, you can augment in those areas as well. So we're going to bring the Voluma here. Now there's two different techniques. You know, if you look at the manufacturer, a lot of times people talk about coming in and drawing straight columns off with the Voluma to kind of bring the tissue out. I do that sometimes, but also that just you can come in and just go into the deep part of the tissue here and just place a bolus of material. And that you can almost see the tissue elevate as you're injecting. And can kind of see that malar eminence kind of be more projected and come out laterally. It's really a nice change. You can just observe it as you're putting the material in versus that kind of column idea where you're kind of packing the columns in here. So we're going to split this between both sides. Yeah, almost done here. All right, and then we're going to come over to the other side, which we traced out beforehand to make sure we're nice and symmetrical. Once again, this bulk fill you really kind of place into a deeper plane than you would some of your more immediately subdermal or intradermal fillers, like the Volbellas, the Bolateros, those kind of superficial injectables. This is not what this wouldn't be indicated here. So we get some nice volume augmentation in this malar region. All right, so got all the injections in there. We're just going to kind of rub these areas, make sure everything's nice and smooth here. Going to go over it really well. Nice, just firm massage over that area. Avoid the lumps and bumps. And sometimes patients ask, "Oh, should I massage it?" I'm like, no, I massage this, and after that, I make sure to tell them, make the point of, you know, you don't massage this. Just my job for right now. If they think it needs to be massaged, I'd rather them come back to me and let me do it. So do the same thing the other side. Have it come on around the front here with the camera. You kind of see what we accomplished there. All right, folks. This is Dr. Green, Coastal Aesthetic Facial Surgery and theaestheticface.com. So check us out. Thanks.